The United Nations says there's mounting evidence of increasing genocidal incitement against Palestinians in Gaza. The world body also raised concerns about what it describes as failure of influential parties to obey calls for immediate ceasefire. The United Nations is concerned with some heads of state supporting Israel, adding that the bombardment of Gaza has been done with intensity rarely experienced in this century. More than 11,000 Palestinians and over 1,000 Israelis have died since the 7th of October in one of the worst fighting in decades. For more on developments in the Israeli-Hamas conflict, we are now joined by Norwegian physician Dr Mads Gilbert, who recently spent weeks in the Egyptian capital, Cairo, trying to enter Gaza to help his colleagues. Dr Gilbert, good evening, and thank you so much for joining us.
Good evening, and thank you for having me.
That must have been quite an experience, spending time in Cairo, trying to enter the Gaza Strip. Just tell us about that, and what was the plan, to, as I said, assist your colleagues, and how did that pan out?
Well, we have a long-standing tradition from Norwegian volunteers, medical volunteers, solidarity workers, to go to Gaza and to the West Bank and to support the healthcare system of the Palestinians. My first mission to work with the Palestinians was in 1981 when I was a young resident in anesthesia. And then I've been doing this work as part of my support for the Palestinian cause, support for the Palestinian healthcare system. And I've been working during all the last bombardments of Gaza in 2006, 2009, 12, and 2014. Very, very, very graphic and brutal bombardments. So when this happened, we immediately set up a team with Dr. Erik Foss and myself. He's a cardiac surgeon. I'm an anesthesiologist. And we have a small Norwegian NGO called NORWAC, Norwegian Aid Committee. We were supported by the Norwegian government. They gave us up to $1 million to buy equipment and support the mission. And we traveled immediately to Cairo, to get into Rafah, because, of course, the northern entry through Israel and Erez was completely sealed off. So to obtain a permission to go through the Sinai desert and up to Rafah, it's about 6-7 hours car ride. You need a number of permissions from Egyptian authorities. And we were unfortunately not able to obtain the last one from the security people in the Egyptian army. And we have been working with our Norwegian embassy. We've done everything by the book, and we've been applying, and we have not been allowed in. Well, not only we, but almost all the other emergency medical teams coming to the relief, and most of the relief trucks are not allowed in because Israel is holding this complete blockade of Gaza. So it's a desperate situation, and I think for the viewers and listeners, it's important to remember that during disasters like this internationally, we always have a humanitarian response. We always provide the civilians with shelter, with water, with food, with medical supplies. Not so with the Palestinians in Gaza. They are incarcerated in this brutal siege that has been going on for 16 years, by the way, and now they're being bombarded and with no access to help from the outside. It's horrific.
We've heard reports of exactly what has happened there, the issue of aid being stopped, even those that are bringing aid being attacked. I mean, what are you hearing and what are you getting from those that you are in contact with that are within the areas themselves?
Well, my main contact is, of course, with my colleagues in Gaza. I've been working with the healthcare system in Gaza for the last 20 years. And I don't only go during these horrific situations with bombardment and military attacks. I teach at a university which is no longer existing, the Al-Azhar University, which the Israelis have bombed and removed from the surface of the earth. I do development work together with my colleagues. We have been working the last 3 years to improve cancer care in Gaza at the Turkish Friendship Hospital, which the Israelis bombed and left the adult patients with cancer with no care. I've talked with them. They are desperate because they cannot provide the cancer patients with the much needed care and treatment of their cancers. 5 of them have already died from not getting their cancer treatment because the Israeli bombed the hospital. I've been working with the Palestine Children Relief Foundation, an American-based, US-based NGO. They have built up the Rantisi Pediatric Cancer Center, which is bombed and shelled and has been, destroyed. And I've been working for many, many years at Shifa Hospital, both during periods of calm and during periods of attacks. And what they're telling me, all of these colleagues, is that these are scenes that are so horrible and so unimaginable that I can almost not share it with your viewers. But imagine a large South African university hospital, the size of maybe 1,000 beds, 1,500 beds. They have all specialties. They have all types of teams for every kind of medical condition and surgical condition, which is Shifa. It was a university-sized hospital. Then you encircle the hospital, you cut the water, you cut the electricity, you cut the food supply, and you cut the medical supply. And then you push into that hospital 50,000 internally displaced persons who seek shelter in the hospital because there's bombing going on all around. And then you put in maybe 2,000 war-wounded, mostly children, who need life-saving surgery. They need follow-up surgery for complicated fractures and large burns. And then, on top of that, you tell the people in that hospital that we are going to bomb you. We will bomb you because you are a military command center. And we will force you to put all your patients in the streets, and we will force you to take all the medical staff out, and then we will come in with some green bulldozers and we will level your hospital from the surface of the earth. What would you have said? What would you have done? I mean, it's unimaginable. I mean, they have been trying to treat these very serious war wounds for weeks now, and the world has been watching as all the hospitals in Gaza have been gradually strangulated from doing their noble humanitarian work of taking care of wounded and injured. We started 8th of October. Then there were, in Gaza, 34 functioning hospitals and 2 were not functioning. On November 14th, 2 days ago, the report from the UN WHO office, the WHO, World Health Organization, this statistic show that now, on the 14th of November, 27 hospitals in Gaza are out of function, and the only remaining 9 hospitals are only partially functioning. So what the Israelis are doing with their army, with their horribly strong army, they attack systematically healthcare. And I've experienced that myself. It's nothing new. They've done that for years and years and years. And these attacks...
Yeah. So I mean, on that point of hospitals being attacked, and you touched on the issue that reports and on the other side saying that these hospitals are being used as military command centers and forcing patients out. How dire is that situation, especially for those, Dr. Gilbert, that are already inside there? I mean, what are they saying? And I guess no safety is guaranteed because we have already seen some of the hospitals themselves being bombarded.
Well, first of all, these claims are absolutely not substantiated by any proof. There's no proof. Israelis are throwing lies all around, and it's part of this fog of war and the struggle of the narrative. They try to create the narrative that the Palestinians, they don't know ethics, they can't count, they don't even know how to count their own deads. And this narrative is extremely dangerous because it is the narrative of the colonizers saying that the colonized people, they know nothing and they are corrupt. They are even shielding, soldiers systematically in their hospitals. And they're doing all sorts of violations. It's not true. It's simply not true. I've been working in these hospitals for more than 20 years. I've never seen a soldier in any of the hospitals. I've been in Shifa. I've been working all around, taking pictures and videos and talking to anyone I like and open any door I like. They've never been controlling my cameras or anything. The Palestinians are decent people, and the doctors are following the universal rules of hospitals being sacred places for humanitarian action and work and care and love, not military bases. And what is the proof? There is no proof at all. Now they're trying to construct some proof in the boxes that they probably brought in themselves, saying medical equipment. They had some uniforms and some Kalashnikovs. What kind of proof is that? This is a huge insult to any of us who understand what the goal is of this attack on Gaza. It is a full-fledged war on the Palestinian people, the occupied people. They shall be denied the right to resist and defend themselves, and they are going to be wiped out. This is what you fought during the struggle against apartheid, because the way that the Israeli army and the government and the US government are treating the Palestinian people is rooted on a deep, deep racism, because nobody who respected the other man would treat any other man the way that the Israeli army is treating currently the Palestinian people. Look, they have killed 6,000 children. That's the number of missed and killed children. Half of the killed, 12,000, are children. How can you call that defense of your country? What a coward army. They go for the hospitals, they go for the civilians, they do massive collective punishment by denying the people water, food, medical supplies, and international relief. What is this, 2023? And you're supposed to have some sort of international order? This is such a blow to all the work we've tried to do the last 20 years to reconciliate the North and the global South. And it's all based on false presumptions.
So what sort of, I guess, Dr. Gilbert, humanitarian aid is needed? It sounds like it's everything. If you're saying that the hospitals themselves are being decimated, and thousands and thousands of people need this sort of aid. I mean, what is needed? Is it like completely from scratch in terms of this aid that unfortunately also is being blocked from entering Gaza?
Well, we know from the UN numbers that before this attack, the hospital system in Gaza had only 40% of the drugs on the UN essential drug list. They had less than half of the drugs needed to run appropriate healthcare because of the siege that has lasted for 16 years. Then on top of that comes the bombing with 28,000 wounded, according to the UN numbers. So, to put it in perspective, no medical system in the world could absorb these enormous numbers of wounded and refugees under normal circumstances. And again, when you take away everything, water, electricity, fuel for the generators, and medical supplies, of course, it's going to fall apart. That said, my colleagues have never, during these 4 weeks, left the side of the patient. They have been standing tall in their work. They've been sick themselves from infections because of lack of water and cleanliness. And they have been threatened, life-threatened night and day by the Israeli occupation forces. And they have been standing tall as an example of what it means to be a human and somebody who cares for your patients.
How are they?
Please, I'm just answering.
Go ahead. Yeah.
Everything is needed now. Everything. Because what we need now, it's actually to rebuild the healthcare system in Gaza. And we are not going to give in to these occupiers. This is not a difficult conflict. This is a difficult occupation that has lasted for far too long. And the impunity of Israel in these attacks that we see now is the net effect of tens of years with impunity, where they have been attacking healthcare with no consequences. We need now a big international movement to rebuild healthcare in Gaza, and we are not going to accept a permanent occupation of Gaza. And all good people in South Africa who remember the fight against apartheid have to stand up now and say that we are with Gaza because we are going to rebuild the healthcare. Now it's all trashed, and the hospitals in the south, which I talk to my colleague there every day, they are being, of course, flooded with evacuees from the north, many of them wounded. And my friend Dr. K, as an orthopedic surgeon, sent me some pictures today of Palestinians walking on foot from Gaza City down to Khan Yunis, and they were shot at in the legs by the Israeli soldiers. How low can you get? You force people to leave, you tell them it's a safe passage, and you shoot them. And 40% of the killed the last 3-4 days have been killed in the south. So this is an endless nightmare, and it needs to stop. But the most important medical thing we have to do now is very simple. Number 1, stop the bombing. Lasting ceasefire. Number 2, lift the siege, allow in water, food, fuel, medical supplies. And number 3, open internationally controlled, not controlled by the occupiers, internationally controlled corridors where medical teams, where supplies and where relief can come in. 1.5 million people, according to the UN, are currently internally displaced in Gaza. It's cold in the nights. They don't have blankets. They don't have food. They don't have water, and they don't have security. We cannot let this happen.
Dr. Gilbert, then what about the safety of, because I mean, the picture that you're painting is quite scary and quite dire, but how do these doctors, those that are offering aid in these hospitals, who maintains their safety? How are they safe? Is there any sort of protection, or are they on their own?
Well, that's a brilliant question. Unfortunately, the protection that I will enjoy in Norway as a white, blonde, blue-eyed doctor under full international sort of acceptance and protection. I would have protection from the Geneva Convention, from the ICRC. They would come to my hospital with white cars with Red Cross flags and say, you can't touch the hospital. Palestinians, the health workers, have no such protection. And I just repeat the numbers from this last WHO report. Israeli attack forces have killed in Gaza these 4 weeks at least 198 health workers. They've killed 31 doctors, 68 nurses, 20 paramedics, 26 pharmacists, and 14 lab people. Some of them that they have killed were my medical students. I teach at the University of Al-Azhar, which no longer exists. Some of them were people I had worked together with. Brilliant people, decent people, Palestinian, proud doctors. They're killed by this attack army who sees no limit. There's nobody shielded from their aggressive killing all over Gaza. Schools, churches, mosques, hospitals, primary healthcare clinics, you name it. If you're Palestinian in Gaza today, they'll kill you.
So, I mean, does this also, Dr. Gilbert, stem from the fact that, I mean, you say that you will get that protection of the red flag, the red and white flag, with the red cross, as it were. But looking at that, these parties are not, signatories to the Rome Statutes, does that also play a role in this instance that I don't know if I can call it the reluctance of sorts, to get involved in that space?
I'm not a legal expert. I'm not a lawyer, but I don't think you have to be signatory to the Roma Statutes to enjoy the universal coverage of the Declaration of Human Rights, which has been, voted and signed by all the nations who are member states in the United Nations. So the Human Rights Declaration also, of course, applies to Palestinians, civilians, and healthcare workers. Absolutely. And it is this combination of demonization of the Palestinians. You just label somebody something. You call them terrorists or you call them Hamas, whatever you want. And then the combination of this demonization and then the lack of international protection, it's a very toxic combination. And there's not so long ago that we put some labels on another people, the Jews. Just to have a yellow star was enough to get you killed. Because they were the others, they were the guilty. They were named as those that we didn't want. And Europe did not stand up to the Jewish people. And we had a horrible Holocaust, which we all feel guilty for. But that was not perpetrated by the Palestinians. So just to name somebody with a name and say, we can kill you because you have no protection, is extremely dangerous. And, I'm not talking, I don't support Hamas, I don't support Jihad or any other PA or Fatah. I support the Palestinian people, like most of the people in the world today do. And I also support their right to resist occupation and apartheid, like we support the Ukrainian people in their armed resistance against the Russian occupation. Why is it that the West is so eager to support the Ukrainian struggle against the occupation? Why is it that the West imposed sanctions on Russia within a week of their attack on the Ukrainian people?
Right.
Because Israel enjoys, as an occupier, unlimited support, and the core of that is colonialism and racism.
Dr. Gilbert, unfortunately we're out of time. We're going to have to leave it there.
Thank you.
Thank you so much for joining us, Dr. Mads Gilbert, a Norwegian physician, just painting to us a picture of what actually happens on the ground in Gaza.